all of us have our own personal life. When we have health problems, we see the doctor for that, handle it for ourselves. But we also have another life. We're a member of a community. And as a member of the community also has health problems. The environment that we live in is the major determinant of the health status of the community.
Environmental health has a very broad definition of protecting public health, and it includes our food, our water, our built environment, our social environment, pollution, the chemical environment, all of those things really outside our bodies that affect our health.
In the 19th century, it was thought if you lived in a bad environment full of crime and disease and poverty, that would affect your morals. And morals were thought to be the chief determinant of health. When the germ theory came along, instead of being worried about the environment, public health officials started to be worried about people who had dangerous germs in them. Anarchists, socialists, symbolic figures like Typhoid Mary, a cook to rich households who was a carrier of typhoid germs and irresponsibly infected rich people.
Food's an integral part of our environmental health story. It's what connects us to the environment and our own health. 100 years ago, people grew food in their backyard. It was pesticide-free, hormone-free, antibiotic-free. The food environment in the cities, though, was radically different. Food was starting to be produced at a massive scale. We had the risk of infection mounting, the risk of injury to workers. They worked with sharp objects, dangerous equipment, and unregulated work environments. We also had the risk of contaminated meat entering into the local food system. The waste was dumped right where people lived. Animal waste, carcasses, the hide from the animals, and there was no zoning to protect these communities.
The tenement in the turn of the century didn't have a bathroom. It was wood and not so fireproof, not insulated, freezing cold. There were pests inside, and because of economic necessities, they were packed in. There was high infectious disease rates, TB, the flu. When you think about the chronic disease risks of the poor air quality in a crowded house with smokers and cooking and lead paint, the lack of ventilation, it was unhealthy to live in our cities. Imagine no plumbing. Imagine where all that poo went.
It means you need public potable water, you need sewage removal, because if you don't, you get things like cholera. At the turn of the century, about 100,000 Americans died of cholera.
100 years ago really was the beginnings of environmental health as we know it today. We realized we needed to be concerned about housing, food, water, air, and infectious disease. We started to chlorinate water. We built sewage treatment. We built sewage infrastructure.
The biggest milestone in public health during the 20th century was delivering clean water and sewage treatment to people's homes. It made a tremendous impact on the decline of many infectious diseases in the United States. And you had people who had a difficult time breathing. Central Park was one of the results of the effort to try to provide breathing space for people.
In the early 1900s, we saw the birth of our regulatory infrastructure. The federal government took its first steps to control safety in the workplace.
Contrast the cows of a few years ago with the fine, healthy, scientifically cared for dairy herds of today. Remember the milking conditions of yesteryear? Compare them with the improved and vastly more sanitary operations of today. Modern and scientific processing like pasteurizing, homogenizing. Modern dairies now, by the use of refrigerated and iced trucks, transport the products to the surrounding territories speedily and efficiently. Milk to you in sanitary containers, sealed within a few hours from the time it left the cow.
In the 1940s, pesticides came along, and specifically DDT. DDT is most widely known for its ability to eradicate mosquitoes and consequently malaria, particularly in the United States. But it also had the benefit of being used in agriculture, and crop yields soared.
We pride ourselves on our high sanitary standards, yet we deliberately make open sewers of our waterways.
The 1970s was the birth of the Environmental Protection Agency and the federal laws that set out to control and improve the quality of our air, our water, our land.
Passage of the environmental laws gave a legal foundation for addressing the nation's environmental problems. What that did not do, however, was look at how the impacts of the environment fall differently on different groups of people. That issue of environmental inequities has been around for a long time. So, for example, Martin Luther King went to Memphis to improve the work environment for sanitation workers. Cesar Chavez organized farm workers around pesticide issues. In 1982, in a protest in Warren County, North Carolina, against the siting of a hazardous waste landfill, 500 people were arrested. One of the people was Congressman Walter Fauntleroy, who requested a GAO study that found that 3 out of the 4 hazardous waste landfills in the southeast were located in majority black counties. That was a watershed moment because it brought civil rights activists and environmental activists in the South together. In 1987, a report called Toxic Waste and Race in the United States showed that nationally, people of color and low-income communities were disproportionately surrounded by hazardous waste sites.
Take a listen to your back, okay? Can you take a big girl breath?
What environmental justice means is that we need to get all the people who are affected, particularly those from communities of color and poor people, involved in the process of environmental decision making.
The first part of what we did was to fence the area so the dumping could stop. You could smell the oil. We started to work on the lot just with the sheer will of the people, and here we are today. Until we extend our understandings of public health to include people working and connecting with the soil as a part of their own health process and becoming healthy and connected again, we're missing a huge part of what is needed moving forward for the earth and for urban and other communities. To my young people, I say, this is your world. You must take ownership in it. What is your part? What can you do? What actions can you make to help?
When you think about it, you spend about 70% of your time indoors. Most people maybe even a little bit more, particularly in certain high-risk environments. They're exposed to pollutants indoors, the legacies of things like lead paint, tobacco smoke, indoor pesticide use. Lots of our exposures that we think are environmental are that housing environment. In the indoor environment, safe housing is a very important part of the future of healthy children.
This was a terrible hot spot over here. It was riddled with drugs, crime, violence. The wood floors were termite-ridden. They had fungus, mold. You know, like with asthma, you have certain things that'll trigger it. Before the renovations, we didn't have an even airflow. I lived here for almost 16 years and never had heat, never. Now that's changed. We got central air, central heat, fans over top of the stove. I think by the changes that are made, that our kids got a sense of self-worth, a sense of confidence. Want some apple? Since the renovations, they'll walk through that gate with their heads held up. So it makes a difference.
We're concerned about children's environmental health because of the vulnerabilities that children have to many environmental exposures and hazards when compared to healthy adults. Children are on the floor crawling, they're exploring, they're putting their hands in their mouths. In the average day of a child, they are exposed to a cocktail of chemicals that were never meant to be introduced into their little bodies. Children in the 1900s had about a 1 in 3 chance of making it to their first birthday. Many died due to fires, farming accidents, mining accidents. There were no child labor laws, no immunizations at the time. They had high risk of contracting polio, measles, mumps, rubella, whooping cough. We've come a long way as banning lead out of our gasoline and paint supply, immunizing our children against many infectious diseases. But now we're seeing increases in childhood cancers, in childhood asthma, increases in exposures to pesticides, and linking now to endocrine disruption.
50 years ago, the common household products were made of paper, glass, wool, cotton. Now almost everything is made from products that are derived from oil. EPA lists some 82,000 industrial chemicals, most of which were developed in the last 50 years. We've made the assumption that these chemicals stay in those products. The reality is they get into our food, they get into our air, our drinking water, and therefore they get into the human body. The DDT is one of the strongest risk factors for diabetes and for heart disease. PCB exposure is a major risk factor for high blood pressure. We're now finding that a whole variety of chemicals change the body's metabolism, and they promote obesity. You can measure almost every class of chemical in finished drinking water. Birth control pills, psychiatric medication, PCBs, DDE. What we're most concerned about are the endocrine disruptive chemicals and the antibiotics because of antibiotic resistance. And we all have some of these compounds in our body. My biggest concern for the future is the fact that we bring new chemicals on all of the time without adequate testing. So we really don't know what they do.
In 1900, there were 78 million Americans. In 2010, there were approximately 308 million of us, but we live in a world of 7 billion. That means that we've put a lot of air pollution into the atmosphere. Air quality affects everyone. Climate change is linked to extreme heat events, worse ground level ozone smog, more intense periods of drought, higher wildfire risks, and pollen production. Climate change is also changing rainfall patterns and threatening to increase the spread of infectious diseases like Lyme disease, West Nile virus, and dengue fever. We realize now, like never before, that our human activities affect the biosphere, the environment, and in turn, what happens in the environment affects our human health in a very intimately connected way. That's the essence of environmental health.
The challenge today is to recognize the interconnections between our air, our water, our soil, the use of our chemicals, and what it means for population health.
Pull hard. Voila. Now carrot. Can you see what's in here, guys? Eggplant.
Schools are a great way to reach kids, to help us make the connection between food, our environment, and our health. And to realize public health change across communities, we need these connections. We need to reconnect with the landscape. We need to understand how we fit in with this larger and interconnected system.